नमामि धन्वन्तरिमादिदेवम् नमामि धन्वन्तरिमादिदेवम् सुरासुरैर्वन्दितपादपद्मम् लोके जरामृत्युनाशम् दातारमीशम् विविधौषधीनां शङ्खं चक्रं जलौकां दधतं मृतघटं चारुतोर्भिश्चतुर्भिः सूक्ष्मस्वच्छादिरुद्यं शुकपरिविलसन् मौलिमं भोजनेत्रम् कालाम्बोदोज्ज्वलाङ्गं कटितटविलसत् चारुपीताम्बराढ्यं वन्दे धन्वन्तरिन्तं निखिलगदमिव प्रौढदावाग्निनीलम्।
Namaste to all of you. Very welcome and good evening. And I would like to inform you that there is a session on the demand of Vaidyas of the Clinical Ayurveda Sambhasha group. As you already attended a previous session, that is very good session, in which the case sheet presentation, how to record a case sheet, that is explained very beautifully by Vaidya Arvind Pathak ji and Kamlesh Kumar ji. Now the second session is of the two case studies based on Charak Samhita, and today's expert speaker is Professor Dr. Raghavendra Udupa. He is Professor and Head Department of Samhita and Siddhant, Yanopaya Ayurveda College, Bangalore, Karnataka. And as usual, as the subject is of Dr. Arvind Pathak, he is also from the basic principle. So he also play a role of moderator during this session. If I want to just looking. Yes, Dr. Udupa, if you are present here, you just raise your hand. So I will make you co-host of this session. And so then I start. Yes, sir. Yes, sir. Thank you, sir. So now I'm just making you co-host. So welcome to this platform. So I'm just introducing that this is I use that platform in which approximately 40,000 Vaidyas are connected directly or indirectly through the social media network, as this program will later on broadcasted at the YouTube channel also. And now this is already live at the Facebook page. And what we are doing, we are just doing disseminating the knowledge of Ayurveda through the each and every clinical practitioner. We want that they strengthen their knowledge by updating their self. So we are just planning a series of lectures from your side. Let us introduce Dr. Raghavendra Udupa. Is a professor and head of the Department of Samhita and Siddhanta, Yadopia Ayurveda College, Bangalore, Karnataka. He has teaching experience of 19 years UG and 10 years PG. He has clinical experience of 19 years in Sri Raksha Ayurveda Clinic, Udupi. His special focus is the clinical practice, that is Ayurvedic diagnosis on the basis of textual references from Charaka Samhita. It's very beautiful. That's our clinical Ayurveda Samvyasa doctors will also update their knowledge. And the Sushruta Samhita, assessment of Graha Roga and Bala Roga based on findings of the aura scanner or geopathic stress scanner, and the preparation of the medicines mentioned in Charak Samhita and Sushruta Samhita in his manufacturing unit. That is the, I think that is Gorgia pharmacy practice of Daiva Viprashraya Chikitsa. It is a very beautiful branch of Ayurvedic science. He is among the editorial board of Savitra Charaka Samhita, published by Munyal Ayurveda, as well as regulatory conductory series of classes on understanding Charak Samhita, Charak Chintana since 7 years, practicing Marma Chikitsa. Oh, very nice. And Asti Bhagna Chikitsa, directed 3 documentary films of Ayurveda on Ayurveda. In 2016, Prakriti Ayurveda Pratisthana honored him with the title A Rare and a Special Personality of Ayurveda. So welcome Raghudepa sir in our this program, and I welcome all of you who is joining from our Clinical Ayurveda Samvasa group, as well as the doctors who are present from the other sites. They joined here. I welcome to all of you. So I request, I'm just allowing the share screen, and just I will request Dr. Udupa to start his presentation on the topic. Thank you, sir. Sir, आप unmute कर लीजिए उधर से. You just unmute yourself as you are posed. Yeah.
Okay.
Yeah.
Then share screen I have to put.
Yeah. I already given you permission. You just
Okay.
share your screen.
Okay.
Yeah.
Okay.
There is an option.
Yeah. Good evening, everybody. Shri Gurubhyo Namaha. Dhanvantarim Garutmantam Manirajam Chakaustubham Achyutam Chamratam Chandram Smaret Aushadha Karmani. Here, as title where it's given a discussion on 2 case studies. That is, I have taken the 2 cases. Both are of from the patient suffering from difficulty in breathing, or in Ayurveda we can call it as Shwasa. And the additional tag for discussion of case study, it's based on the textual references of Charaka Samhita. Of course, in classroom also we discuss in the same manner, but here what I'm telling, it's of different methodology, where the patient is interrogated with the direct references, or patient will be asked with some of the explanations which are explained in the text, and he should say yes or no to the textual references. I'll explain in detail. And you may ask, why such plan, or why such thing it's needed for Ayurvedic practitioner? Usually,
Can you clear screen, full screen? If you
full screen, it's not coming.
Yeah.
Just I'll do it.
No, slideshow. There is an option slideshow, sir. Kindly put your
slideshow. Yeah, it's there.
Yeah. No, there. Here. Just click here.
Yeah.
Yes.
Okay. So
and then just from beginning, slideshow from beginning.
Beginning. Yeah.
Full screen. Yeah, full screen. Do it
okay.
Screen.
Yeah, it's slideshow.
Set up slideshow. Set up
slides. Just a minute. Set up. Yeah. Okay.
No. Here. It is here. Just
bottom.
No. Upwards.
Starts.
Custom. Yeah. Start slideshow. Yeah.
Start. Yeah. It's not connecting. That's the problem. It's not moving.
No, it's from current slide. Just do it from current slide. Just custom slides.
Just a minute.
From beginning,
yeah, from the beginning. Okay. Yeah.
Now it's
here. What I wanted to highlight is, when we study in the classroom, we study Charaka Samhita as a text, which is a book, which we can call it as read-only book. That means for examination purpose, or gaining some knowledge, and to answer in the examination, we read Charaka Samhita and we forget the things. And when we come to the clinical practice, especially the practitioners, we forget many things from Charaka Samhita, and we concentrate mainly on Aushadha Skandam. or the medicines or the treatment modalities. If it is of a Panchakarma setup, we think about the various Panchakarmas, what can be done for this particular patient. And every time we experiment with the medicines. That means every time when patient is telling, no, I am not getting expected result, I am not having any improvement, then we change the medicine, and continuously that will go on. And one fine day will come that every practitioner will have this problem. You feel that I am unable to understand this person, whether he is having some psychogenic problems or whether he is suffering from Manasa Roga, and you feel that this is totally, I cannot deal such patients. So there are approximately 10 to 15% of the patients in every clinic were like this. So when you have a clear idea about the textual references, and when you have some based on the Brahatrayis, or here I'm telling only about Charaka Samhita base, then you will be confident, even though person or the patient is not getting the result, you will be having a base so that you can change the medicine and you can get the thing. So with that intention, I'll start with the first case. The patient name, we will keep it as SL, and age is 35 years.
Sir, slide is not visualizing properly. I think that you just put it
Okay.
in
What
not
I have to do?
slideshow way.
Okay.
Yeah, just remove the slideshow.
Okay. Minimize. Okay.
Minimize the slideshow. Yeah.
Okay. Just a minute.
Press escape. Yeah.
Escape. Okay.
Escape button.
Okay. Yeah.
Yes. Now it's okay. You
Oh,
can continue. Yeah.
Okay. That female, aged about 35 years. She is from this particular place, Udupi. She came around 10 years ago, around 2011, and she complained about only two complaints, that is difficulty to breathe and continuous cough. So it is chronic. And when I asked more, she told whether even the running nose or pratishaya was there, and sometime she was feeling heavy headache or severe headache. So it was there since 5 years. So usually this is the pattern of every patient. When they come and sit in front of you, they say only few sentences. And of course, you are also asked some more questions, and you will get some idea that this is this particular diagnosis. And when I asked the treatment history, or when she told in the history of present illness or HPI or history of present complaint, so usually the patient will add a treatment history also. I have been there, and I have taken this medicine and all. And when treatment history is revealed, initially she took allopathic medicine with a diagnosis of allergic bronchitis of chronic nature. She took medicine, and she has shown the list of the medicines, and she continued for 2 years, and there was no much response. And sometime she could feel that there was a response for 15 days. Again, there was recurrence. So she started to shift to the medication to homeopathic medicine. And she took homeopathic medicine for 2 more years, and there was no improvement. And every time she was feeling that I will be better on one particular day, but that day didn't come. And then she shifted to Ayurvedic treatment by an Ayurvedic physician, and she showed the case history written by that particular doctor. Here I am explaining everything of the previous doctor, Ayurvedic doctor also. It doesn't mean that he is not knowing anything about Ayurveda, but just to tell how the diagnosis and prognosis and treatment differs when you have a textual reference. So the previous Ayurvedic doctor, he diagnosed it as Samakashwasa, because the symptoms were like that. She was suffering from difficulty to breathe or dyspnea, and when there was severe attack, she could not able to speak properly. That is Krucharat Shaknoti Bhashitum, as explained in Tamakashwasa, Charaka Samhita, Chikitsasthana. Then when she was taking Shleshma Vriddhikara Aharas or Viharas, the condition was aggravating. That is Shleshmalaihi Abhivardhanaihi. And the diagnosis, it is a very straightforward diagnosis, and the treatment planned, again, it is a textual reference, Tamaketu Virechanam, as told in the Charaka Samhita, Chikitsasthana, 17th chapter. And then after Virechana, Snehapana is done, then Bahya Snehana Svedana is done, and Virechana, that was Samyak Virechana. Then after that, Samsarjana Krama, everything is properly followed, and it is properly advised by the physician. Then after that, after Prakritigata Lakshana, Shamana Aushadhas are given. Again, those Shamana Aushadhas were disease specific. Those are Shwasahara Aushadhas. Then also there was no improvement. And when you get such form of patients, you feel that I should study something else, or I should study based on text. And you feel that this is the right method, what the Ayurvedic physician is done. Of course, it's a almost proper diagnosis. Then question comes, how to diagnose? Because it is already treated by many systems of medicine, even the Ayurvedic treatment, it was failed. And then you have, or what I practice in my clinical practice is, it is based on a pure textual references. In the clinical practice, we have three skandhas or Triskandha Ayurveda, Hetu Linga Aushadha Jnanam. And in the clinical practice, we see the linga or lakshana and we diagnose. And then we go for some causative factors. And then we think about Aushadha as the medicines which are disease specific. Those medicines or Panchakarma therapies were selected, and then the medicine will be given. So this is a routine thing. And usually when we do the diagnosis, because of our institutional thing in Ayurveda, as we study Ayurveda, like the 50% of Ayurvedic explanation and 50% of modern explanation, your mind or the mind of a physician is always, it is a mixture of modern and Ayurveda. And what happens when you have a knowledge which is half of one system and half of other system, sometimes the diagnosis will go hand in hand. And you feel that I should get more attachment towards modern thing for proper diagnosis and proper causative factor. You will go for some laboratory investigation or some other investigation, and then you will come to a diagnosis. But just imagine around 15th century or just before 15th century, before the proper invasion from Britishers, we didn't have much thing of the modern medicine knowledge. And then what was the parameters which was practiced during those days? Then it is clearly, it is about the textual references. Whatever it is discussed in the previous thing, Astasthana Pariksha and all, it is a very recent one, like around 17th century or 18th century. In Yoga Ratnakara and all, you will have the Astasthana Pariksha and all. And before that, before 15th century, what was the parameter? How the olden Vaidyas or ancient Vaidyas were diagnosing and practicing. And if you have that mentality, I'll go back. That's called a retrospective journey. When you think that I'll move back, I'll go back to the 10th century or 12th century. then your mind will be very clear that I will not have anything from outside of modern. Then you start reading Charaka Samhita and you start understanding Charaka Samhita. It doesn't mean that you should not study modern medicine at all, but the main intention is to understand the concepts which are explained in the textual references. And that's what in Charaka Samhita Sutrasthana it is mentioned. That is Tasmat Vikara Prakriti Adhisthana Antarani cha Samuthana Visheshamsha Buddhva Karma Samacharet. Here in this slide, I'll make a statement. From here onwards, I'll use the references of Charaka Samhita only to understand these two disorders and to diagnose and to treat. So this is my Pratijna. I will not go even for a Sushruta Samhita or Ashtanga Hridaya or any text of Ayurveda or any parameters which are previously utilized by other Vaidyas. So Charaka says there are three things you have to remember for every disease. One is Vikara Prakriti, then Adhisthana Antarani, then Samuthana Vishesha. So these three should be clear to you, and then Karma Samachare. You should do the treatment. Karma means here Chikitsa, and Karma or the Chikitsa should be followed only after understanding these three parameters. And Vikara Prakriti, as told by Ashtanga Hridaya, as Vikara Lakshana. If you refer Ayurveda Shabdakosha, you will get a word meaning Vikara Prakriti is Vikara Lakshana, or the clinical feature of a disease. And then Adhisthana Antarani, that is the Ashaya. There is a mistake, which it is written as Ashya. It is Ashaya. Ashaya or Srotas, where the disease is manifesting. And Samuthana, that is a Paryaya for Hetu. So these things you have to understand. And according to the previous Ayurvedic physician who treated this particular Shwasa case, when you put these three things, Vikara Prakriti, it is Shwasa Rogam, and especially it is Namaka Shwasa. Then Adhisthana, as the Shwasa, it comes under Pranama Srotas. Srotas is Ashaya or Adhisthana. Then Samuthana or Hetu, it is as told in Tamaka Shwasa, Mega Ambushita Pragvataihi and Shleshmalaicha Abhivardati. So these things are taken as Hetu or positive factor for Tamaka Shwasa, and it is treated. And when you see the word meaning of Vikara Prakriti in Charaka Sutra, you can see the Vikara Prakriti, it has Vikara and Prakriti. The Vikara, the word meaning is Vikriti, and it is added with Prakriti. That means having is a deviation from the normalcy. Prakriti means it is normalcy. So that is the Vikara Prakriti or Vikriti Prakriti, we can say that. And when you use Padartha Tantra Yukti, then what it says, Padasya Padayoho Padanam Va Artha Padartha, as told in Charaka Samhita, last chapter of Siddhisthana by Chakrapani Vakya. The Prakriti means it is Swabhava, the innate nature of anything that is called Prakriti. And in Charaka Samhita Vimanasthana first chapter also, while explaining Ashta Ahara Vidhi Visheshayatana, there it is mentioned, Tatra Prakriti Uchyate Swabhavo Yaha, the innate nature of anything that is called Prakriti. And when you add that word to Vikara, that is Roga, then it comes Vikara Prakriti or Roga Prakriti or Roga Swabhava or Vikara Swabhava. So this is known as Swasamnya Tantra Yukti, a word coined by Agnivesha, and it is utilized in Charaka Samhita Shlokasthana 17th chapter, where Vikara Prakriti means it is Roga Swabhava or Vyadhi Swabhava. If you read Chakrapani commentary or any commentary, you don't get this meaning. And most of these words are not answered or not explained by commentators. That's why you have to use Padartha Tantra Yukti and Sasamya Tantra Yukti to understand that. So Vikara Prakriti means Vikara Swabhava or Roga Swabhava. What does mean that Vikara Prakriti? That means when you ask history of present illness, then the patient is explaining very few things, like as he or she is visiting 10th or 12th doctor for his or her problem. They are not interested to explain things in a elaborative way. They say only few things. I have cough, I have dyspnea, I have headache, and I have running nose. And if you ask more, then they ask since how many years it is there and what are the medication they have taken. Those things will be explained by the patient. And in those conditions, what I do is I get an idea that I should open this particular chapter of Charaka Samhita, and then I start reading Charaka Samhita directly in front of the patient. And this method I'm following since last 19 years, since beginning of my clinic, Siddha Raksha Ayurveda clinic at Udupi. I'm doing that I get an idea that I have to open this particular chapter, and then I ask these questions to the patient. And in the beginning, as a beginner, you feel that you will have some doubt in front of the patient that am I doing something wrong, that nobody is doing such practice in the clinic, whether this is the right method or not, whether I'm getting some answer by this method or not. And simultaneously in the patient mind I got report recently that initially they feel that this doctor doesn't studied anything in the classroom. That's why he is opening the text in front of me and he is searching few pages of a book called something called a red book, or this is called red book, what I'm using in the clinical practice. So red book in front of me because in North India, this red book is very popular in astrology called Lal Kitab. I hope most of you are aware of that Lal Kitab. So similarly, this doctor is utilizing Lal Kitab. He's reading, opening and reading few pages of Lal Kitab, and sometimes he's turning the pages continuously, telling nothing about my problem, and finally he tells something. And after so many years of the treatment, then I got the report that this is really good for me. That happened good for me. So that was the report that I'll explain you later. I opened a page in Charaka Samhita in Chikitsa Sthana. Then I asked whether you feel tiredness. She said yes. Since last 5 years, I am feeling tiredness. And then I asked whether you have tiredness on exertion or dyspnea on exertion later on. She told yes. Even if I walk few steps, I feel that dyspnea on exertion. And then I asked, as she is living in a flat, I asked, when you go up using the staircase, whether you feel tiredness, that is called Arohana Ayasha in Charaka Samhita. She said, yes, this is quite interesting. Is it mentioned in the text? She asked. Yes, I told. Yeah, it is mentioned in the text. And I have to see the other symptoms also. Then I asked whether you have giddiness. Then she said yes. Then I asked, how is your appetite? She told, yeah, it's not so good when compared to previous, when compared to 5 years ago. And then I asked whether you have reduced taste or lack of taste sometime. She said yes. And then I asked whether you have pain in any part of the body. She said, I have low backache and sometimes I have radiating pain in both of the legs. Sometimes I have pain in both the knee joints. So that is pain is explained by her. Then I asked whether you have hair fall. She said, yes, I have a severe hair fall. And then I said, this is a reference. We have a reference for your problem in a book called Charaka Samhita, and what we call it as Pandvamaya or Pandaroga. And she got some interest, telling that, okay, at least something is written for my problem in this book. Then, of course, after these symptoms, then I asked whether you have dyspnea and cough. She told, yes, now also I'm having these problems. So this method, it is called Aptopadesha Pramana, or utilizing Aptopadesha Pramana. So here you have two aptas. One is the apta who is sitting right in front of you, that is patient, that is patient's word, which can be called as Laukika apta. And the another one is textual references, like whatever I read in front of the patient of Pandvamaya or Pandaroga, it is written long back, around 3000 years ago or so on. So it is Alaukika apta. It came from generation, so it's called Alaukika apta. If you read Charaka Samhita, Vimanasthana, 4th adhyaya, that is Trivida Roga Vishesha Vijnaniyam adhyayam, Chakrapani gives a commentary on Aptopadesha Pramana that we have two types of aptas. One is Alaukika apta and Laukika apta. You just refer that. I'm not going in detail about that because we are discussing a case. And your idea is to match the words of Laukika apta or a layman or a patient to Alaukika apta. So there should be a matching between the words given by the patients or told by the patient and words explained in the text. So that method is followed here. And the diagnosis, approximate diagnosis, what I made is Pandvamaya. And Vikara Prakriti, it is called the eliciting the symptomatology as told in the patient and as told by the patient and as explained in the text. That is Vikara Prakriti or Roga Swabhava. So she told beginning it was only a slight dyspnea or a fatigue. Then dyspnea developed and Arohana Ayasa, that was there. And then there was hair fall, giddiness, and then reduced Agni, and Aruchi was there. And then Shwasa and Kasa, it is manifested. And if you see the symptoms which are explained in Charaka Samhita Chikitsa Sthana, Pandvamaya Chikitsa, in sloka number 13 and 16, you have these words like Hata Nalaha, reduced appetite, Brahmaha, giddiness, Shramaha, it is tiredness, then Shwasa, and you can correlate it with the Shamaswasa also, then Gadra Shula, then Shiranaloma, that is hair fall, Hataprabha, that is paleness, and Arohana Ayasa. Along with that, I asked few more symptoms which are explained in Charaka Samhita Pandvamaya Chikitsa, that is Shishiradveshi, that is patient is not liking the cold, or the best way to answer or ask is you ask whether you put fan during night or not. If he or she says, no, I don't want to put fan on, then it is Shishiradveshi. Because this symptom I have seen in many patients. Then Durbalaha, the bala of the person is very minimum. Then Pindiko Dveshta, that is the cramps in the muscles, especially calf muscle, that is Pindiko Dveshta. These were experienced by the patient, and she told, yes, I have these problems. Then she started feeling that I should explain more. Then she explained something about her family and all, and I diagnosed it as Pandvamaya Samanya Lakshana. In the clinical practice, when you diagnose it as Samanya or Pandvamaya as a general disease, it is not sufficient because you have to select some drugs, you have to give some medicines, then you have to go in depth about the diagnosis. That is, in diagnosis, we have for few disorders, we have Samanya Lakshana and Vishesha Lakshana. And for example, in Prameha, the Samanya Lakshana is Prabhuta Avilamotrata. Vishesha Lakshana is based on Varna, Gandha, Rasa, and Sparsha. We have Vimshati Meha. that is Panchendriya Pariksha is utilized. Similarly, in Pandvamaya, we have Samanya Lakshana and Vishesha Lakshana. You just go through the text of Charaka Samhita, you will get it. And what it is explained in the end of Samanya Lakshana is Vishesha cha asya vakshyate. After explaining Samanya Lakshana like Sambhute Asmin Karnakshveda Hatanalaha and so on, it is explained as I have introverted with the patient. Then the Vishesha Lakshanas are explained. And the Vishesha Lakshanas for each dosha it is mentioned. For Vata dosha, Pitta dosha, Kapha dosha, then Sannipataja and Mritmakshadajanya. It is explained. And as a beginner, I went from Vataja Pandvamaya Lakshana till the Kaphaja Pandvamaya Lakshana and Mritbhakshana Pandvamaya Lakshana. I could get these symptoms like Shwasa, Kasa, Aruchi, then Vakagraha and Swaragraha, that is difficulty to speak and difficulty for the proper pronunciation or proper voice. Then Shleshmalehi Vivradha, as told for told or informed to the previous Ayurvedic physician, then giddiness and Ushna Kamatam. And these are explained in Shleshmaja Pandvamaya Lakshana. Initially, you diagnose it as Pandvamaya Lakshana, and the Vishesha Lakshanas goes maximum for Shleshmaja Pandvamaya Lakshana, and I made a diagnosis as Shleshmaja Pandvamayam, or this lady is suffering from Kaphaja Pandvamaya or Shleshmaja Pandvamaya. And then you may ask a question, why I have selected the Pandvamaya chapter? What is the reason not referring Samaka Shwasa? You opened Pandvamayam. Then I can explain with the two reasons. One is based on Vidana Tantrayukti. Vidana Tantrayukti means it is Tantrakaraihi Varnaya Vidhamati or Vidhayati or Varnayati. There is an order in Charaka Samhita that you should follow. If you follow that order, in Chikitsa Sthana, 16th chapter is Pandvamaya Chikitsa or Chikitsitam, and 17th chapter is Hikka Shwasa Chikitsitam. That means there should be a link between Shwasa Roga and Panduroga. Or, in other words, you can say that Shwasa Roga may be produced from Panduroga. That is the Vidhana Tantrayukti. That is, there is a order, like how the Rasa Rakta Mamsa Meda Asti Majja, it is explained. It is based on their formation. Similarly, in Chikitsa Sthana, every chapter is placed in a particular place, and that is Vidhana Tantrayukti. And if you follow that Vidhana Tantrayukti, Shwasa Roga or Hikka Shwasa comes after or immediately after Pandvamaya. And if you see the Chakrapani Vyakya on the first shloka of Hikka Shwasa, where it says Panduroga Karanatvat Hikka Shwasa Yohu Panduroga Anantaram Abhidhanam. That is, Hikka and Shwasa, they manifest after Panduroga. And this is a Vyakya of Chakrapani. And if you see the Charaka Samhita Chikitsa Sthana in the original context, it says Pandurogat Hikka Shwasu Gadau Pravartate. Hikka and Shwasa, they are manifesting because of Panduroga. So that's why I selected, I opened the chapter of Pandvamaya, because there is a connection between Hikka, or I mean Shwasa and Panduroga. That's why the previous chapter, it is referred, not the exact Shwasa chapter. And if you see the thing of Adhisthana, like Vikara Prakriti, it is of Kaphaja Pandvamaya. Then Adhisthana, if you see the Samprapti of Pandvamaya, it says Pitta dosha is predominant, that is Doshaha Pitta Pradanastu Yasya Kupyanti Dhatushu. The dosha, it is Pitta, and the Dhatus are involved, or the location or Adhisthana, it is in the Dhatus. Then Shaitilyam Tasya Dhatunam Gauravam Cha Upajayate. There is Dhatu Shaitilyam or Shitilata of Dhatu, and there is Guruta of Dhatu also. Along with that, Ojaso Gunaha Vrajanti. the ojas, which is considered as sara of all dhatus. The qualities of ojas. There are 10 qualities of ojas, which is explained in Charaka Samhita in the context of Vishachikitsa that you have to refer, and those qualities will be reduced, and the person is feeling or person is exhibiting the symptoms of dhatukshaya of rakta and medaska, that is alparakta and alpamedaha. What are the features of alparakta and alpamedaha? You have to refer Charaka Samhita Sutrasthana 17th chapter, where Astadasha Kshaya is explained, in which the Kshayavastha of Rakta and Kshayavastha of Meda are explained. And Nissara means the Sarabhaga of all dhatus are reduced. That's why even Ojas is also reduced. So this is the information about Adhisthana. And then if you see, I have tabulated here Vyadhi Vinishaya of 3 Vikara Prakriti, Adhisthana and Samutthana of textual reference, that is Charak Anusara, what I have made, and Lakshana Anusara based or which is done by previous Ayurvedic physician. Here Lakshana Anusara or the Vikara Prakriti of previous diagnosis, it is Tamakashwasa, and what I made is Shleshmaja Pandvamayam. Then Adhisthana, according to previous physician, that was Pranava Srotas. Here I made it as Dhatavaha. Even Ojas is also there. It is not written there. And then Samutthana, where the previous doctor, he considered it as Swatantra Vyadhi or an independent disease, and I made it as Paratantra Vyadhi. And what is Paratantra Vyadhi and Swatantra Vyadhi? It is explained in Charaka Samhita 6th chapter of Vimanasthana, that is Swatantro Vyaktalingo Yathokta Prashama Upashamaham. That is a disease which is having Hetu Linga Aushada, which is independent to that particular disease. And when you follow those Upashama or Aushada, the disease will be subsided. Whereas Paratantra Vyadhi is dependent on some other disease or some other main disease, and when that particular disease is or main disease is treated, this disease will subside. That is Swatantra and Paratantra, or the other terminology given by the Charaka for that Swatantra and Paratantra is, it is Anubandhya and Anubandha Dosha. Even for Vikara also, Anubandhya Vikara and Anubandha Vikara can be applied. So that is the difference between the diagnosis, what you have studied in the classroom, and when you start opening Charaka Samhita in the clinical practice. So there is a lot of difference. Like you can see a marked difference between Vikara Prakriti, Adhisthana and Samutthana. It's quite opposite. You can say that is Samutthana, that is Swatantra in the earlier diagnosis. Here it is Paratantra Vyadhi. Similarly, the Srotas is also changed. Instead of Pranama Srotas, if you refer Charaka Samhita, then Dhatus will come into the play. And then Vikara Prakriti, instead of Tamakashwasa, you will have Shleshmaja Pandvamaya Lakshana. So that's what Charaka says in Sutrasthana 20th Maharoga Adhyaya. He says, Rogamadu Pariksheta Tato Anantaram Aushadam. That is, initially you diagnose or you do pariksha of roga, like Vikara Prakriti, Adhisthana, Samutthana, etc. Then Tato Anantaram Aushadam Pariksheta. Then you have to examine the Aushadas. What is Aushada Pariksha? I'll explain you later. And then Tataha Karma Bishak Paschat Jnana Purvam Samacharet. Then you start or proceed your treatment. So this is the idea of referring Charaka Samhita. You may feel something unusual that this is not practical, but with my experience of last 19 years, what I felt is you will have clear idea if a patient is responding to your treatment. Even if he is not responding to the treatment, then also you will have a clear idea. You will not feel anything which is like a doubtful mind, or you will not have lack of confidence whether he will get some cure or not. So it all depends upon linking the many references of Charaka Samhita. It is called Yoga Tantra Yukti. Vyastanam Padanam Ekikaranam or Vyastanam Vakyanam Ekikaranam. So based on Yoga Tantra Yukti, you have to select many references of Charaka Samhita and then try to link it, and then you will get the idea about the disease. So this is the Vyadi Vinishchaya what I have made. And then here in the previous slide, it is mentioned Jnana Purvam Samacharet. Jnana Purvam Samacharet means usually we think that we should get some knowledge and then you have to proceed in the treatment. When you apply Hetvartha Tantra Yukti, then Jnana Purvam Samacharet can be understood as Ayurveda Purvam Karma Samacharet. Instead of word Jnana, you replace it with Ayurveda. That is, Ayurveda has a synonym like Jnana. If you refer Charaka Samhita Sutrasthana, 30th chapter, 31st shloka, there it is mentioned, Tatra Ayurveda, Shakha, Vidya, Sutram, Jnanam, Tantram, everything it's mentioned, iti anarthantaram. So if I say Jnana in the context of Charaka Samhita, that means it is Ayurveda only. So Jnana Purvam Samacharet means Ayurveda Purvam Samacharet. What does it mean? We have, as we have studied in classroom, about 50% of modern and 50% of Ayurveda, we have some preconceived ideas about the disease. Like this disease is incurable, or this disease is not having any medicine in modern medicine. Then similar thing we think in Ayurveda also. That is not considered as Ayurveda Purva Karma Samacharet. Ayurveda Purva Karma Samacharet means you should get some references in Charaka Samhita, what is explained there, what is explained about Sadhya Sadhyata, and then you think about that, then you proceed. That is called Ayurveda Purvam Karma Samacharet or Jnana Purvam Samacharet. And then the treatment, that's karma, or the treatment of this particular lady, Samanya Siddhanta for Shleshmaja Pandvamaya is, it is Mradubihi Tiktaihi Samshodhya. You have to give Mradu Shodhana with Tiktarasayukta Aushadam. And that was done by the previous Ayurvedic physician, that is Tamaketu Virechanam. The Shodhana is already done and there was no response. That's why I have not taken that particular Samanya Siddhanta in this particular lady. I selected Vishesha Siddhanta. What is that Vishesha Siddhanta? If you refer Charaka Samhita, first chapter, Dirganjivitiya Adhyaya, in the last portion of that particular chapter, it says, Purusham Purusham Vikshya Vaishajyam Achari. Every individual should be considered separately. No individuals are alike. So that should be the idea behind treating every patient. You might have numbers or hundreds of patients of same diagnosis, but every individual is different. That's how the police department, they consider in any crime. No crime is similar. That is their idea behind every criminal or every crime. Similarly, in diagnosis and treatment, every patient is specific and there is no similarity, then that is called Purusham Purusham Vikshyam. As patient is 3, there is a special class in Charaka Samhita Vimanasthana 8th chapter, that is Vyaditarupiya Adhyaya or Rogabhishek Jitiya Adhyaya. That is, you should not give Shodhana to a lady. That is mentioned. Visheshatha Chanari Ta Hi Anavastita Mradu Vivrata Viklava Radayaha. The mindset, it is very soft. And then Prayo Sukumaryaha, they are Sukumara in nature. Abalaha, the physical strength is less. And then Parasamstabhyascha, they are always dependent on others. So that's why any medicine should be given Uttarottara Gurubihi. That is, initially the mild medicine should be given and then the strength of the medicine should be increased. So that is the the special Siddhanta or Vishesha Siddhanta for a female. Whenever you have a patient, lady or female, then you should bear this mind that is applicable for old age people and even for children. So that is Vishesha Siddhanta. And I have not administered any Shodhana because it is the earlier treatment. It was Tamaketu Virechana. Based on that, Virechana was given. That's why the Virechana, it is not administered. Instead of Shodhana Karma, the Shamana Karma or Shamana Aushadha, it is selected. And how to select the medicine? That is, we have disease specific medicine. If you open any of the textual texts like Vaishya Ratnavali or Yoga Ratnakara or Charaka Samhita, you have list of medicine. Then which form of medicine should be selected? So that is called Rogam Ado Pariksheta, that is already discussed. Then Tato Anantaram Aushadham Parikshetam. So Aushadha Pariksha means it is the form of medicine. Every medicine, it has a form, like either it may be Panchavida Kashaya Kalpana or Ghrata Yoga or Asava Yoga or Arista Yoga or Churna Yoga and so on. We have different the formulations. And what Charaka says, if you have a patient of Vataja Pandvamaya, then you should proceed or process Grata and should be administered, like Dadimadi Grata or many other Gratas are explained there. If it is Pittaja Pandvamaya, then you can see the list of Churnas and Vatakas or tablets and Avaleha. These should be the form of the medicine. If it is Shleshmaja Pandvamaya, then Arista Yogas are explained. And in the clinical practice, we are not thinking about form of the medicine. You may ask why it is so important. If you see Charaka Samhita and Sushruta Samhita, in the context of Prameha, almost all the yogas are Vata yogas or Kasha yogas. In Charaka Samhita, for Pittaja Prameha, Dasha Prameha Hara yogas or Vata yogas are mentioned. And for Kafaja Prameha, Dasha Vata yogas are mentioned. And for Vataja Prameha, the same Vata yogas are selected and Grata is prepared. So that is mentioned in Charaka Samhita. If you see Vata Vyadi, only Taila yogas are mentioned. No tablet, no Churna, no Asavarista, nothing is explained in Charaka Samhita. Similarly, in Shleshmaja Pandvamaya, the Arista is mentioned. The Arista or fermented liquid, which is mentioned in the Charaka Samhita in the form of Datrya Arista, Bijaka Arista, and one more is explained. And in the end of Panduroga Chikitsa, if you see a shloka, Panduroga Prashantyartam iti proktam maharshina vikalpyan etat vishaja prasak dosha balam prati. It means if your diagnosis is Vataja Pandvamaya, then select Grata Yoga, then that is Grata Vikalpa. Then if it is Pittaja Pandvamaya, then Churna or Vataka should be added or Vikalpana should be done. If it is Shleshmaja Pandvamaya, Arista should be done. But in clinical practice, we are not giving much importance for the form of the medicine. Which form of the medicine is ideal for this particular patient? It comes only if you diagnose as per the textual references. Otherwise, you will not get idea how to select a different form of medicine for a specific disease. And based on that, I have selected Kanakabindvarista. You may ask, Kanakabindvarista is explained in Kushta Chikitsa, and why you have selected medicine from Kushta Chikitsa of Charaka Samhita. It is the dose is 15 ml, then Muhu Matra, that is 5 to 6 times in a day. It was administered during acute attacks of Shwasa. When there was no Shwasa, or when she is free from the symptoms of Shwasa, 2 to 3 times Kanakabindvarista is administered for a dose of 15 ml. thrice or twice daily. Because the Aushadha Prayoga or Aushadha Sevana Kala, if you study from Charaka Samhita Chikitsa Sthana, it says Shwasa Kasa Pipasashu tu Avacharim Muhurmuhu. The frequent administration of the medicine is administered for Shwasa. That's why Kanakabindvarista is administered repeatedly during the attack of Shwasa, and symptom-free period, it was administered twice or thrice daily. So that is also important when you handle a patient. You should know when should you increase the dose of the medicine and when should you cut down the dose of the medicine. And in the classroom, nobody will teach you how to cut down the medicine and how to increase the medicine. So it comes by practice, as the wordings of the patient is every time matched with the textual references. And if you see the indication of Kanakabindvarista, as told in Charaka Samhita Chikitsa Sthana, 7th chapter, Kushta Chikitsita, it says, Arshaha Shwasa Bhagandara Kasa Kilasa Prameha Shoshamsha Pitva Aristum Kanakabindum. So Kanakabindvarista, it is explained along with Kushta even for Shwasa Roga and as well as Kasa Roga. Even in Prameha, I utilize this particular Arista because the indication says it is indicated in Prameha. Am I audible now? Because here it's heavily raining. Am I audible now? Am I audible?
Audible,
okay,
sir.
Okay. We'll continue. So the Kanakabindvarista, it is administered, and along with that, usually I go to the root of the disease, whether disease is Santarpana Vikara or Apatarpana Vikara. If you see the list of Santarpana Vikara as told in Charaka Samhita Sutrasthana, 23rd chapter, Santarpaniya Adhyaya, where Pandvamaya is explained as a Santarpanotha Vikara or Santarpanimitajaha Pandvamaya. So it is a Santarpanotha Vikara, and usually I select some of the medicine from that particular list because this disease, any disease, whether it is Kushta, Prameha, Vata Vyadhi, or any disease, either it should come under Santarpanotha Vikara or it should come under Apatarpanotha Vikara. So here, in this particular patient, as this patient is coming under Santarpanotha Vikara, I selected some of the medicines which are explained in Santarpaniya Adhyaya. That is, if you see the list of the medicines given there, it is Triphala, then Trikatu, Musta, Vidanga, Chitraka. What I do in my clinical practice is, I have the tablet of Triphala in the name of Varavati. I have the tablet of Trikatu or Trikatuvati or Trikatu tablet, and I have the powder of Musta, Vidanga, and Chitraka. And every time I'll change these medication along with the main medicine, like along with the Kanakabindvarista. Along with Kanakabindvarista, sometime based on Nadi Pariksha, I change to Triphala tablet. Sometime along with Triphala tablet, Chitraka Churna is given if the Agni is not proper. Sometime along with Kanakabindvarista, Trikatu tablet is given, and along with that, the Musta Churna is given. So it is like you have to satisfy the mentality of the patient. If you give only Kanakabindvarista and if you say this is the medicine which can cure your problem, he may not be satisfied with that particular wording. So you have to give the medicine, few medicine, at least 2 or 3 medicine, not only one medicine. With that intention, I select the root cause of Pandvamaya as it is Santarpanotha, and along with the Kanakabindvarista, I use Triphala, Trikatu, Musta, Vidanga, and Chitraka. In Charaka Sutrasthana, 23rd chapter, it is mentioned Trushanam, Triphala, Kshaudram, Kramignam. Kramigna is Vidanga. So these are indicated in the list of Santarpanotha Vikara. So any medicine you can select. That means if you follow Charaka Samhita, you can practice yogas which are in the form of formulations like Grata Yoga, Avaleha, Chur, Asava, Arista, etc. Or you can practice single drug therapy also, like the here what the list is explaining. You can practice with the Triphala, you can practice with the Triushana or Trikatu, you can practice with Musta only, because if you see the list of Dashemanis which are explained in Charaka Sutrasthana 4th chapter, Musta comes under many Dashemanis. Similarly, Vidanga and Chitraka also, they are coming under many Dashemanis. So you should be very confident of using single drug also in the clinical practice. You have a base why you have selected these particular drugs. And if you see the main context of Pandvamaya, there you have Namayasa Churna in the Pandvamaya, where Triushana, Triphala, Musta, Vidanga, Chitraka, that is Triushana, Triphala and Trimada along with Ayoraja or Loha Basma. Even you can give Namayasa Loha other than Trikatu or Triphala or Musta, Vidanga or Chitraka. But the problem of Namayasa Churna or Namayasa Loha, which is available in the market, you don't get the genuine Namayasa Loha in the market. And they are adding the Loha Basma prepared out of the blades which are using for the shaving purpose. That is processed and Loha Basma is prepared and that is dispensed. In many areas of India, we have the Loha Basma prepared out of used shaving blades. That is documented by a few of the doctors of Shastra. That's why you don't feel that it should be given to the patient, and you don't feel that the person is getting the result out of your medicine. If you want to give Namayasa Loha, you prepare your own Namayasa Loha and you prepare your Loha Basma and then you can use it. Very rarely I use Loha Basma because it is very expensive when compared to the market thing. That's why very few conditions I use Loha Basma in Pandvamaya or even Shwasa. And the indication of Namayasa Loha is Bhaksha is Pandu, Radroga, Pushta, Arsha, Kamalapaham. Even in Pandvamaya also that can be utilized. So here I have selected the medicine for Rogagnata, a disease specific medicine, as well as Santarpanahara medicine, so that you have a base for your practice. If somebody will come and ask you why you have given these medicines, then I can explain. I have these things, and because of that, I explained or I have administered these medicines. So that should be the idea of clinical practice. Clinical practice doesn't mean that you have more number of medicine which are very disease specific and then you will get the result. It's not the case. When you refer Charaka Samhita, your number of medicines will be minimized, and then you can select a single drug for many diseases, or based on the matra you can change, or you based on formulation you can change a same medicine in different areas. So that is the advantages of referring Charaka Samhita. And after administration of Kanakabindvarishta and drugs which are selected from Santarpani Adhyaya of Charaka Samhita Sutrasthana 23rd chapter, with the medication of 6 months, she completely relieved from Shwasa and Kasa, along with the symptomatology which she explained that I have these problems and I had these problems earlier. Those are also reduced, and now she is free from the illness. And previously she was not taking ice cream or any other thing because of fear of dyspnea. Now she is regularly taking that, and only on rainy season she is avoiding. Other than that, on other seasons she is taking that. She is coming to the clinic not for medication, just to ask some question about Charaka Samhita. Sir, I have this problem, whether it's written in Charaka Samhita or not. She purchased Charaka Samhita and she is reading Charaka Samhita. For those purpose, she will come to my clinic and she visit my consultation room. Otherwise, she is free from disease. So that should be your idea, how to select the medicine. So it doesn't start from the selection of the medicine. It starts from Vikara Prakriti, understanding Adhisthana, and then understanding Samuthana. Then the selection of the medicine, which is disease specific, and then arranging the medicine based on Rogagnata and Santarpana Patarpana condition, and then you can practice. So this is my first case where you have some time to understand a patient, and you have some time to think something, and you can go to home and you can read Charaka Samhita, and you can ask the patient to come after 1 day or 2 days. So that is the idea in this particular patient. The second patient where I have faced recently, a male, we call him as KM, aged about 60 years, and it is quite recently, some 2 months ago, this case I faced, where the patient is suffering from severe breathlessness, that is Shwasa is increased 3 plus. He is suffering from Dwara, the constant fever, and Atisara, then a form of delusion or confusion, that is Moha, and the appetite, it is totally lost, and he is feeling severe uh, weakness, that is Dorbalya, and he was COVID positive, and he was admitted in a hospital for 5 days, and after that, when they tested, the report became negative, and they discharged that particular patient, and even after discharging from the hospital, he is continuously having a progressive illness. Progressive illness means every time within a gap of 2 hours, or sometimes even within an hour, there was a relapse of a symptom, or there was appearance of a new symptom. So that was the condition. Here you have minimum time to think and act. So that is the thing. When this patient consulted me, I told that I can do something, but every time I'll change. Even it could be like within 1 hour, I may change the medicine, or within 2 hours, I may change the medicine. And every time you have to follow my words. Then only I can treat you. And she told, okay, we will follow your words. And then one more thing I told, even after treatment, sometime I may tell this is not possible to treat, or if I get some Arista Lakshanas, I may discontinue medicine. Then they told, okay, you can do it. That's not a problem. Then I, if you see, then you can see it is the Sannipata Jwara. We have 15 types of Sannipata Jwara in Charaka Samhita. And every time there was shift from one type of Sannipata Jwara to another. So that is called the changing of doshic balance in that particular patient, where you have to be very careful for each and every minute. So I can summarize with the 3 shlokas which are explained here. Sometimes he could feel severe headache with shivering and dyspnea, then irrelevant talk, then vomiting and loss of taste. Then your idea is like it is a Hina Pitte, Pitta is very minimum, Madhya Kafe, Kapha is moderate level, and Marutadike. It is a Jwara where the Vata is having a dominant role. Then sometimes he exhibited the symptom like the dyspnea and cough, a very severe form with the dryness of the throat, and then Parshvaru, pain in the sides of the chest. That is Mukha Shosha and Parshvaru. Those, when it is exhibited, I understood that as Kapahine, Pitta Madhye, Vatadike, Linga, Sannipata Jwaram, where instead of Madhya Kapha, Pitta is coming to the moderate level, Kapha is minimized, and the Vata condition, it is as well as it is same, that is Vatadike Lingam. Sometimes I could see the symptom of samasannipata jvara like kshane daha, kshane shitaha. Sometimes he was feeling burning sensation all over the body. Sometimes it is severe form of cold. Then asti sandhi shiroruja, pain in the bones, pain in the joints, and severe headache, along with cough and dyspnea. Then that is samasannipata jvara. Whenever you get a samasannipata jvara in the clinical practice, you don't get much result because all the three doshas are equally strong, and every time when they are changing in the body, it is not so easy to assess the doshic level in the body. It is called kasta sadhya or sudarunaha. It is severe form of the illness. Then along with that, uh, it is like I got some of the Arista Lakshanas also. What are those Arista Lakshanas? I'm not explaining here because the list is very long. I could see the Lakshana, Arista Lakshanas related to mind, where the mental strength it is reduced, lack of memory, and irrelevant thought, those were there. And the person, he was fearing about death, those things were there. Then the Arista Lakshana related to Indriyas. He was seeing something which is not seen by me or the family members. That is called Indriya Arista. And then the Arista Lakshanas related to Sharira. That is the muscle wasting, that was severe. The physical strength, it is very minimum. So that is called Sharira Arista Lakshana. The complexion of the patient, it was so dull and so dark that he is totally from fair complexion to he is converted into dark complexion. That is Varnaswarya Indriya, that is also considered as Rishta Lakshana. And then related to the other aspects of disease also, there were some Arista Lakshana, that is called Vyadhi Rishta Lakshana, like a sudden breathlessness along with jvara and atisara, that is considered as Rishta Lakshana. Those were exhibited by the patient. And when I got Samasannipata jvara, Lakshana and Arista Lakshana, then I told family members, probably I should stop my treatment. Then they told, no, we don't have any option. You just continue your treatment. If here his daiva is good, his luck is good, then he will survive. Then I continued the medicine, and the medicine I'll tell you later. Then what is the mode of or nature of your mentality when you treat such patient means it is just like you are extinguishing fire in a house where fire is so heavy. That is jvara. If you see the word meaning in dictionary, jvara and jwala or jwala are same. It is nothing but Agni Mahabhutam. If a person is suffering from jvara means he is afflicted with fire, or according to Charaka Samhita or Sushruta, the inside fire, Kaya Agni, it has spread all over the body and it is showing its result. So that is Agni Mahabhuta is acting a role. And if you see the Nidarshana Tantra Yukti, which is explained in Charaka Samhita Nidanasthana, it says about the similar explanation. Yatha prajwalitam veshma parishinchanti varina naraha shantim abhipretyam. It is about Jirana Jvara, of course, context is different, but he says when you treat a Jvara patient, it's as if you are trying to remove the fire out of a house which caught fire. So that is like you are like a person who is working in a fire brigade. So that is the your intensity of thinking and acting. You are not getting much time for think and act. So that is the area of the treatment of jvara, especially in Samasannipata jvara. Then in the same chapter, Charaka Nidana, first chapter, he says, Udakam iva agni plushteshu dravyeshu. Imagine something which has caught fire, then you have to subside fire means you have to put water over that and the action should be quick. So that is Udakam iva agni plushteshu dravyeshu. Similarly, in this particular patient, I should act very quickly, and I should act properly with proper thinking. And then I told the Arishta Lakshanas were observed. I have only a few slides. I'll complete within 5 minutes. Arishta Lakshanas I could observe, and Vikrita Jnana, that is disorientation from the normal perception of knowledge, that was absent, and Balakshaya was there, and Jwara Shwasa along with some other symptom that is considered as Rist Lakshana. And one more symptom which is explained in Charaka Indriyasthana 9th chapter, it says Balamamsa Kshaya, where reduction of physical strength and the mamsa, Tivro Rogavriddhi, a constant progression of the disease, along with aruchi, Yasya Aturasya Lakshyante, Treen Pakshan Nasa Jivati. If you see these symptoms in a patient, then he will live up to only 21 days. That is the rule given in Indriyasthana. Whenever you see Indriyasthana or Rishta Lakshanas, you should know each and every shloka of Indriyasthana. Then only you can get an idea that this person is suffering from, or this patient is suffering from Rishta Lakshana or not. Only by seeing one or two Lakshanas of Rishta or Indriya Rishta Lakshanas, you cannot say that this person is going to die. But I could observe many Rishta Lakshana in this patient. That's why it is informed to the patient. And as per Charaka, you should not tell that you are going to die directly to the patient. You have to inform the patient party, and same thing is followed. And they accepted that my helplessness regarding treatment of this, and they said, you proceed, whatever will go, we will accept it. So then it is the treatment, how I selected, it is Aushadha Yojana. I selected the few drugs from Kasa Haryani Dashayamani of Charaka Samhita, Sutrasthana 4th chapter, Shwasa Harani Dashayamani, again from the same chapter, and Jwara Harani Dashayamani. And when I make a list of those drugs, it is Triphala, Sariva, Patha, Manjista, and Draksha, which are explained in Kasa Harani Dashayamani. And in Shwasa Harani Dashayamani, again Draksha is explained, Bhumyamalaki and Punarnava. And even Jwarahara Dashayamani, this Triphala, Sariva, Pata, there was some change. Triphala, Sariva, Pata, Manjista, and Draksha, it is mentioned in Jwarahara Dashayamani. Bhumyamalaki and Punarnava, it is mentioned in Kasa Harani Dashayamani. Sheti, Bhumyamalaki, etc. are mentioned in Shwasa Harani Dashayamani. And according to the symptoms of the patient, each and every hour, I referred Bhava Prakasha Nigantu along with these medication, and the medicine is changed every time. The Kvata Kalpana of these drugs, that is permutation and combination of these Kvata Kalpana, it is given, that is on hour basis, every hour, only from night 12 o'clock to 6 o'clock. I was not able to see or I was not able to contact those people, but they were in touch with me with the symptomatology, and quite a few occasions I consulted once in a day at least. I consulted or I visited the patient's house, and with these medications, Triphala, Sariva, Patha, Manjista, Draksha, Bhumyamalaki, and Punarnama, Sheti, he got improvement. He was gradually improving, and then after some 10 days after medication, the Agni or Kaya Agni, it was improved, and then he got some confidence that I'll come out of this particular condition along with this oral medication, Bahya, Sneha, and Sweda. That too very mild form of Sweda, it is administered especially to chest region. Otherwise, he could not sleep properly because of suffocation. That's why, otherwise in Jwara, usually we don't do Svedana, especially Agni Sweda. But because of the condition, I advise to do Nadi Sweda, especially for chest region. And then now he's all right. He has come out of illness, and even he is gradually recovering from lack of strength or weakness. And he can now he can come to my clinic and he can talk to me directly. So that is the condition. So these are the two cases what I have explained for case studies. And in first case, you have some time to think and act. And in the second case, it is you are having hardly minimum time to think and act. So that's why read Charaka Samhita properly, then understand Charaka Samhita properly. It's not so easy to understand Charaka Samhita. You have to apply Tantra Yukti and other aspects. Then only you can understand. Understand it properly, then apply it on the patient. Then you feel that you are doing some great service to the society. Though the patient is not recovering from your treatment, then also you have some idea that because of these things, he is not showing improvement. Of course, if he has shown improvement, then you feel great, and even the patient, they will come along with family members. They ask about this red book, and few of my patients, they have purchased this Charaka Samhita, that is English translation of Charaka Samhita. Here, most of the people, they are quite fluent with English than Hindi translation. They have purchased this English translation of Charaka Samhita, and they read sometime about some of the interesting points. So this is how how I diagnose and how I proceed in the treatment and how I select the medication. If I say only medicine before these theories, then you feel that this is not proper method. When all the aspects of a disease is explained, like Hetu, Linga and Aushadha, then only you will be able to appreciate the depth of knowledge which is explained in Charaka Samhita. With these few words, let me conclude my topic of the Shwasa discussion based on the Charaka Samhita. If you have doubts, then you can ask.
Thank you, Dr. Wodepa sir. If you have any doubt, you can ask your queries directly. I just unmute your mic. So if you have any questions related with this sessions, you can directly ask with Dr. Wodepa. मैं आप लोगों को अनम्यूट कर रहा हूं. अगर आपके कोई प्रश्न है तो आप सीधे पूछ सकते हैं. मैं आप सभी को अनम्यूट कर रहा हूं. 1 minute. Yes, you can directly ask questions. Yes.
Sir, I am Dr. Arvind Saxena from Lucknow. Sir, my question is, first of my question is, you used Tanabindu arrest in the case of this
Yeah.
Right, sir. So you used as it is in a Muhur Muhu Matra, this 50 ml.
Yeah.
as expressed in श्वास व्याधि में भी जो है हम लोग देते हैं कनका सब वगैरह, वो मोहर मोह देते हैं. The dose you decided 15 ml as a मोहर मोह in how many hours you give it, and मतलब 2 घंटे में दिया, 3 घंटे में दिया. And the second question is कि जो आपने क्वार दिया है दूसरे केस में, you used त्रिफला सारिबा पाठा, जो आपने बोला कास हरियाणी, you used in how किस divided dose में दिया, सुबह शाम में दिया या 3 बार में दिया, how you adjust this part?
Okay, I'll try to explain in Hindi. If something goes wrong, you please excuse me. Okay, पहले केस में मैं बताया था जो श्वास में मुहर मात्रा में दिया, तो उसमें 5 से 6 बार यानी सुबह से लेके रात तक कितना प्रमाण वो देके
please unmute yourself, others please unmute.
Okay, yes. So it is divided dose 5 to 6 times, 5 से 6 बार दिया था. और क्यों 15 ml से शुरू किया, क्योंकि तो स्त्री में उत्तरोत्तर ग्रुप ही पहले स्मॉल डोज में देना बहुत अच्छा है. अगर कुछ एडवर्स इफेक्ट है तो और भी कम कर सकते हैं, अगर कुछ नहीं हुआ तो बढ़ा सकते हैं, तो इम्प्रूवमेंट हुआ तो उसी को कंटिन्यू कर सकते हैं. ऐसे एक आइडिया से 15 ml को 5 से 6 बार दिया, रात को फिर उठ के लेने का ऐसे कुछ बताया नहीं, सुबह से लेके रात तक वो 5 to 6 टाइम्स. और सेकंड में जो केस मैंने बताया जो पेशेंट था, तो उसमें 1-1 घंटे में मेडिसिन को सेलेक्ट करके फोन पे किया था. मैं डायरेक्टली जाने का सवाल ही नहीं था तभी कभी। तो ये ड्रग को उनको बता के नाम का एक एक करके डिब्बे में रख के दिया था उनको। तो ऐसे ऐसे ड्रग को लेके इतना प्रमाण में लेके क्वाथ बनाओ और इतना क्वाथ जितना वो पी सके, कभी कभी 5 ml भी पीना मुश्किल होता था, तो जितना हो सके उतना पीना है। ऐसे करके सेकेंड डोज में फिर वो मुंह मात्रा ही था, लेकिन ज्वर में मुंह मात्रा नहीं बताया, लेकिन सिम्टम्स हमेशा वो चेंज होते रहता था। इसलिए वो सोच के मुंह मात्रा जैसे ही 1-1 घंटे में, कभी कभी 2 घंटे में, और एक बार रिकवरी फेज शुरू हुआ तो 3 घंटे में एक बार, और उसके बाद 4 घंटे में एक बार, बाद में दिन में 3 बार, ऐसे करके अभी दिन में एक ही बार मेडिसिन है, वो बल्य औषधि यानी बल्यानि दशयमानि उसका मेडिसिन है। तो देख के पेशेंट का कंडीशन देख के वो मात्रा और काल को डिसाइड किया था।
चलिए, और किसी के प्रश्न हो तो आप पूछ सकते हैं। इफ एनीबॉडी इज एनी क्वेश्चंस।
Namaste, sir.
नमस्ते।
Dr. Sahana here.
Yeah.
Sir, excellent presentation. Sir, I have one doubt. In the second case where you explained the Arishta Lakshanas, but the patient seemed to be recovered. So whether this to be considered as Abhasa of the Arishta, or if it was real Arishta, sir? How to differentiate in the clinical practice, sir? Is
No,
this
like-
Abhasa or real?
No, like there are conditions like Rishta Abhasa and Rishta Lakshana. And what here I should deviate some from Charaka to Sushruta. What Charaka says, it is Rishta Lakshana if it is observed, you should not treat. Or if you give Mamsarasa for 1 month, and if person is or patient is improving, then you continue the medicine. So that is the treatment principle given by Charaka Samhita. Whereas Sushruta, he says, you give Rasayana and you give some Daiva Pashya Chikitsa, Brahmanaihi, Kila, Amalaihi, those references you can read from Sushruta Samhita. If Rasayana or some Daiva Pashya Chikitsa, if it is administered, then if he is showing some form of improvement, then you continue the medicine or you continue the treatment. So that is the treatment principle. So when I got the Rishta Lakshanas, when I started seeing the Rishta Lakshanas, I told you just make some arrangement so that the patient can hear Vishnu Sahasranama, as told in Charaka Samhita. Vishnu Sahasramurdhanam Characharapatim Yugun Suvannama Sahasrena Juran Sarvan Vyapohati. And then they told, okay, if you tell, then we will do it. So they made some arrangement to hear Vishnu Sahasranama, again in the form of Daiva Pashya Chikitsa. I have not explained that because it is not to the context, that's why I have not explained. Then medicine is continued, and then he started showing some improvement in the form of Agni. When Agni is increasing means the Vyadhi will definitely going to reduce. So that is a general rule in clinical practice. Then I thought, or then I told, this is a plus point, a positive side, what we are observing. Then they said, okay, you continue, because they had no other option other than my treatment. I don't know how they showed so much of confidence on me, but they told, without you, we are not going anywhere. So I continued. Then other symptoms gradually they showed some improvement. So it is either a proper Rishta Lakshana or Rishta Bhasa. Definitely not Rishta Bhasa, because it is a Rishta only. Because of some form of Daiva Pashraya like Vishnu Sahasranam and all, probably a added effect is observed there.
Thank you, sir.
Any questions? If you have any, you can ask. अगर किसी के पास कोई प्रश्न हो इस सेशन से रिलेटेड तो यू कैन आस्क. So I hope that there is no question, and so thank you Professor Udupa for a very nice presentation. अगर किसी के पास प्रश्न है, भारती देशपांडे जी, राकेश ग्रोवर जी, anybody?
Hello.
Yes, you just introduce yourself and directly ask.
Yeah.
नमस्ते सर, मैं
नमस्ते।
भारती देशपांडे बात कर रही हूँ सर। सेकंड केस में जो आपने ज्वर की केस बताई, तो ये जीर्ण ज्वर में ही हम ले सकते, वी कैन डायग्नोस लाइक दैट एंड वी कैन ट्रीट, क्योंकि जीर्ण ज्वर में तो हमें घृतपान और या सिद्ध घृत या सिद्ध क्षीरपान भी एडवाइजेबल है ना पेशेंट को देना, या सिर्फ
हाँ,
स्वाद से ही ट्रीट कर सकते हैं? क्योंकि
एक
ऑलरेडी धातु क्षयात्मक संप्राप्ति तो शायद होगी.
okay. The thing is, the question is about whether you consider it as Jirna Jwara or Navina Jwara. The general rule for assessment of Navina Jwara and or Nutana or Purana Jwara or Navina Jwara is, it is a time gap, 8 days, and after 8 days, generally it will go to a state of Jirna Jwara. That is a rule. And how you diagnose Navina Jwara or Namajwara and Purana Jwara? It is based on, again, based on Charaka Samhita reference. If you have the list of symptomatology, if you see, there are 3 set of symptoms like Jirna Jwara Lakshana, Pachyamana, and Amajwara Lakshana. You can see in the Charaka Samhita. And every time when I was seeing, the patient never crossed the Amajwara Lakshana. He was there in Amajwara Lakshana only. He never came to like Pachyamana Jwara Lakshana and like Jirna Jwara Lakshana till 15 days after discharge from the hospital. So your general rule of after 7 days, it will go to the Jirna Jwara and you have to give Gratapana. That Samanya Siddhanta will not work, because as per your textual references, as per your scanning of symptomatology with the patient's words, or the matching of Laukika and Alaukika Apta, the Laukika Apta will not show any symptoms of Jirna Jwara. He is there in the Amajwara Lakshana only. That's why I have not selected any Grata Yoga. The reason is the Agni, one is he is there in Amajwara Lakshana. The second reason is the Agni is very minimum. Even the digestion of a small amount of Vata is also a bit difficult. There was repulsion from the medication. So that was very difficult. That's why the Jirna, even after 15 days, the Grata Yoga is not started. Only the Kvata Yogas, it is continued. And one more thing is like whenever you are getting some improvement, the patient party are so anxious that they expect something new in every day, and you are not getting any time to think about some form of experiment. Like as the COVID-19 case is very new to me, it's like experimenting. I'm experimenting on a patient. Whereas the Kvata Yoga, even if it goes wrong, that will not make much harm to the patient, and the symptoms will not aggravate. Based on that, you have to be on safer side. What I played there. So only Kvata Yogas are continued, and now he is totally recovered from the illness. Then probably from next week onwards, I may think about some Grata Yoga or some form of mild Shodhana or so. So it is now you can think, you have time. But during those 15 days, I didn't have much time to think about those things.
Yes, is there any question?
One of my question एक और है मेरा सर.
Okay.
Sir, as you mentioned, जैसे आम ही तंतुबद्ध अनुबुद्ध शूलम है, वो तंतुबद्ध है, और वो जो है पित्त धरा मज्जा अस्थि धरा कला में एब्जॉर्ब नहीं होता है. So then how it is creating problem? जैसे शोतो में धातु लेवल के धातु पाक के बाद कैसे वो अग्नि को समान अग्नि होने के बावजूद भी अगर वो तंतुबद्ध आम है और वो पित्त धरा मल धरा कला से अब्जॉर्ब नहीं हो रहा है, तो वो धात्वाग्नि लेवल धात्वाग्नि अग्नि को कैसे क्रॉस करके और वो रोगों का कारण कैसे बन जाता था?
ओके, देख अभी आप क्या पूछ रहे, लाइक सम कॉन्सेप्ट्स बिहाइंड द डिसीज. What I do in the clinical practice, I don't think much about things which are going inside the body. What I am looking every time is the symptomatology which the patient is exhibiting. So that's the only clue you are getting what is going inside the body. As I told in the last question, last answer, like why the Jirna Jwara or Grata Pana is not done, because I was not getting any symptoms of Jirna Jwara. Only he was there in Namajwara Lakshana or Amajwara Lakshana. That's why I was not thinking about what is going inside the patient's body. So what happens in the clinical practice is when you think too much about the theory, leaving about observing the patient's condition or the symptomatology, we will be confused. What will happen? Kya ho raha hai? That is the thing. So if you practice Charaka based theory or Charaka based practice, then you don't try to think on such aspects. Only think about the symptoms which he is exhibiting. Then what is your role to do that? What Charaka says in the context of treatment, your duty is to give treatment. What is treatment? He says a patient who has fallen on the ground, even he can lift or he can come or he can stand properly without your help. But if you give a hand and he can stand very quickly and within no time. So that is your idea. That is your duty. Like see the symptoms, understand the disease, in which condition it is, and then give the treatment as per the text. And if you going to the theoretical portion like Majjadara Kala or Pittadara Kala and all, you are deviating from the understanding of the patient. Like you have lack of confidence or you feel that you have not seen much patient's condition. So whenever you give treatment, try to observe the patient. You should use your Pancha Jnanendriya in a proper way so that every minute thing will be observed by you. Then you don't try to think about the theoretical portion which you have studied in the classroom. Of course, I'm not saying that those are not important, but it should be helpful to the practice. But if you follow this, you will get the success. Then you think about these things, then you feel that this is not so important in the clinical practice.
Any questions? Balasubramaniam, you want to ask a question?
Yes. Good evening, Udupa sir.
Let introduce yourself. Yeah.
Myself, Dr. Balasubramanian. I'm actually a student of Dr. Udupa sir. I did one class on the Sayush Darpan regarding the Kerala Panchakarma. I think you remember.
Yeah, I remember.
Sir, Udupa sir, namaste.
Namaste.
Sir, actually regarding that Jora, some discussions came. I have some doubt regarding the present COVID-19 infection. Okay. So because actually usually we have to categorize in the Jora, no?
Oh, yeah.
A type of Jora in that. But we find that during the positive cases of the COVID-19, the allopathic doctors are actually preferring for taking what are the food items they need, whether it is easily digestible or not digestible, they are patients are taking now.
Yeah.
So actually our concept is exactly contradictory, that Lankhana is the first treatment that we have to follow in Jora.
Yeah.
So nowadays, in second wave, there are so many post-COVID complications and death rate are highly increasing.
Yeah.
Whether it may be due to that Agni is being distorted by taking such heavy food during that first stage, or during that post-stage type, whether you feel such any...
It's there. I have observed a few patients, like I have not treated them, but I have observed the few patients, like once they get rid of the symptoms of fever and other symptoms, immediately they come for the normal diet. And then what Charaka says, when your Agni is not so proper, not in a condition to digest the heavy food, then there is a condition called Punaravartaka Jara. If you see the symptoms of Punaravartaka Jara, almost all the symptoms of relapse of a disease that will be there in Charaka Samhita. And when there is Punaravartaka Jara, that may run for years together. I have a patient of Punaravartaka Jara who is having the Jara episodes since last 5 years. You may ask whether Agni is not so good to digest or Ama is still there. There are many theories you can explain, but he is suffering, a boy of 17 years. He is suffering from Punaravartaka Jara. So the patient may go for Punaravartaka Jara, and if he is elderly, and if he is suffering from some other diseases like Prameha or some Hridroga and all, he may get affected very quickly and he may die, because it is explained in the text. When you are not respecting your illness, when you are not respecting your body, then the disease may come at any time. That's why in Charaka Samhita, what he says, even after cure of the disease, you should not take bath. And if you think about some thermoregulations of the body, then that's true. You may think in any angle, but those things is observed as per the Ayurvedic theories.
Okay. Thank you, sir. Thank you.
So I think that ये बहुत ज़्यादा काफ़ी लंबा हो गया और 2 घंटे हो गए और I hope that it's अभी तो लोग questions लेना चाहेंगे तो बहुत आएंगे. So very much thankful, Professor Udupa. So we will meet in on next Sunday with the next topic. I'm just announcing, sir. I think that your next topic is. You can announce, sir. What is the next topic?
Next topic, just I'll see. I like.
Yeah.
You have there directly. Otherwise, I have to see paper I have written there here.
Yeah. I am also.
Yeah, it's there. It's there. I'll show you.
Yeah.
It is like second topic, no? Like
second topic.
Yeah. Differential diagnosis of Nija Roga and Agantu Roga with an example for each, based on the references of Charaka Samhita. Like
so this is the next lecture.
Yeah.
On the next Sunday at the same time with the same meeting ID and password at the same platform. So I request all of you to join these sessions, as this lecture will also be broadcasted after some time in YouTube also. So you can watch the premiere at the YouTube also. So wait for the 1 week. So we will keep this throughout series of lectures by Professor Udupa. So thank you, sir. We will meet on next Sunday at the same time with the same meeting ID and password at the same platform. Thank you. Namaste. Bye-bye. Good night.